Normal worry is an efficient evolutionary tool. When a glass slips from a counter, your brain instantly flags the immediate, solvable problem and releases the adrenaline needed to catch it. But in an always-on brain, this threat detection system runs endlessly in the background without a clear target to resolve. This continuous process drains cognitive energy, even during moments intended for relaxation. The mind remains occupied with anticipating worst-case scenarios for mundane, everyday events. Millions of people experience this chronic state under the assumption that it is an unchangeable personality trait, often labeling themselves as just a worrier. By dismissing this constant dread as a quirk of character, many remain unaware that their body and mind are caught in a silent, destructive cycle of depletion. Generalized Anxiety Disorder, or GAD, is a distinct clinical condition. It is governed by strict criteria in the DSM-5 that separate it from the standard ebbs and flows of daily stress. Affecting 6.8 million U.S. adults annually, data shows women are diagnosed at roughly twice the rate of men, frequently during midlife. Diagnosis requires a specific duration. To meet the GAD threshold, uncontrollable worry must persist for more days than not for half a year. Clinical GAD involves both cognitive worry and a specific set of severe, sustained physical symptoms that manifest alongside the mental distress. Meeting these 6-month criteria identifies a documented medical disorder. At this stage, the condition has moved beyond a temporary feeling and cannot be resolved simply by trying to relax. Uncertainty triggers the nervous system, translating abstract fears into physical alarm. The body manifests this through chronic muscle tension, GI distress, and disrupted sleep. This physical exhaustion feeds back into the brain, degrading concentration and making it even harder to control future worry. Because these physical symptoms are so intense, they often mimic other medical issues, like cardiac distress or hyperthyroidism, which can lead patients toward the wrong diagnostic path. GAD is a self-sustaining biological cycle where the anxious mind exhausts the body and the exhausted body further destabilizes the mind. Because of this complexity, professional clinical assessment is essential. The well-documented mechanics of the GAD feedback loop provide a clear framework for treatment. Because the process is understood, it can be systematically targeted and severed. Cognitive behavioral therapy and acceptance and commitment therapy address the cognitive side of the cycle. These methods help the brain rewire how it processes and tolerates uncertainty. Pharmacotherapy, such as SSRIs or SNRIs prescribed by a physician, addresses the physiological side. These medications help lower the nervous system's physical alarm threshold. While both approaches are effective, the clinical gold standard is combined treatment, which addresses the physical and psychological components of the disorder at the same time. Treatment focuses on repairing the hijacked physiological system, allowing individuals to reclaim their baseline self. If the feeling of an always-on brain and unexplained physical tension have persisted for months, the necessary next step is a clinical assessment from a licensed professional. Coping and Healing Counseling, or CHC, provides access to a diverse, culturally competent team of licensed therapists specifically trained in these evidence-based treatments. CHC operates a 100% HIPAA-compliant telehealth model, serving all 159 Georgia counties, often providing patients with same-week availability. This care is designed to be accessible, with acceptance of major insurance plans and a $0 copay for those on Medicaid. You can begin a targeted 12 to 20 session treatment plan by visiting chctherapy.com. Now it is time to switch off the background noise and finally take back control.